Hello, I am Katherine Aguilo. I'm a senior in animal science, as many of you may be too, and I want to talk about bacterial placentitis in mares. So, placentitis, it is a condition in mares that results in early delivery or abortion of the foal. It happens between 8 to 10 months into the pregnancy, and it's a bacteria that migrates from the vagina to the cervical canal to the chordae allantois. The chordae allantois is one of the two members making the mare's placenta. It's the one connected to the uterus. The other one is the amnion, which is the one that actually surrounds the foal. And the chordae allantois breaks during birth while the foal goes through the cervical canal. And how does it happen? The chordae allantois is infected through the cervical star region, which you can see in the image in the screen. And it spreads the bacteria through the placenta, through the rest of the placenta, and leads to necrotizing inflammation. This can also lead to production of prostaglandin, the start of the premature labor by contraction. So as you can see on the screen, there's a placenta with placentitis, which shows it inflated and thickened, and this can also impede delivery of the oxygen to the foal, which is one of the main reasons abortion happens. In very rare cases, you can still have a delivery of the foal, but it will need extensive neonatal care. One of the risks that you can have by having a premature foal is that the hypothalamic pituitary adrenal axis is going to be underdeveloped, and that's also going to lead to very extensive care. In only few occasions, the foal may survive with minimal care. So symptoms. Placentitis has several symptoms, which are premature udder development, vulva discharge, stiffening of the cervix, early lactation, and abortion. The most common clinical sign is the premature udder development, which may or may not lead to vulva discharge. Vulva discharge is one of the symptoms that most people don't use because it's not the best for diagnose. Because it's so hard to notice just because of a small amount of discharge that can happen, or the mare just removing it with its own tail. Early lactation also happens because of the increase of production in progesterone, and then you also have abortion, which is the last sign, and usually there's no warning when it happens. So detection tool. We have the transrectal ultrasonography, transabdominal ultrasonography, and progestin concentration. Transrectal ultrasonography is used to detect fetal activities and also to examine fluid change in the biamniotic evaluation. The fluid is tested by the foal and for the infection. The abdominal ultrasonography examines the foal. So it examines its heart, the rate, the movement, size, and activity, which will determine if it's going to be aborted or if it's healthy. It can also be used to detect if the mare is having twins. Progestin concentrations are used to detect labor and also see for abortion due to decreased concentrations of the plasma and progestin. Some of the methods that are used are the ELISA and the P4 radioimmunoassay. So some of the treatments that are being used are antimicrobial treatment, anti-inflammatory therapy, and tocolytics. Most of these are being attempted in several studies. At the University of Florida, they've been using antimicrobial therapy so they can delay parturition in mares and use it as a control experiment. Anti-inflammatory therapy is actually been used at the same time as antimicrobial treatment. It's been used in 2 other studies that show that it could cause more positive manner and more successful rates of live fools. Tocolytics suppresses prostaglandin and stops the premature labor from happening. And these are all used on research right now. So nothing is concrete except the anti-inflammatory used more. So I wanted to learn more about placentitis because it's actually the main reason for losses in 2011 by 30%, and right now in Kentucky it is the main reason for losses in mares and foals and mares. It also, I was a little bit curious about it just because of the reproduction side. And it also prevents a lot of owners to receive income by reproduction by the foals, and it costs a lot of money, which means that many owners will not take the steps required to prevent it. And also, this could mean loss of a mare due to making it an unwanted horse due to lack of reproduction. But I found it a really interesting topic and I liked it a lot. So, thank you.